Eli and Talon won Fortnite yesterday together. They were pretty excited about it.
Gallery. Okay, let's see. Participants.
Also, can you see this mug? Isn't this amazing?
Yes.
Ah.
Jackie Shy made it. She sells her pottery in like places downtown Hood River.
Mm-hmm.
This is not a plug for her intentionally, but it's my favorite mug in the world. So
why not?
Yeah,
we're supporting local
small business. Exactly.
Yes.
Exactly.
Is it like
an right now?
H.P. Lovecraft mug?
I mean, I don't think it's intentionally an H.P. Lovecraft mug. It was supposed to be an octopus, but it turned into a squid because that's a better handle.
This is my drink. Just water in a clear Starbucks cup. That at one point was in a fish tank that I had, but that was years ago. So
that seems unhygienic.
It's definitely clean and sanitary now.
Oh yes, Rita has her queen mug. I feel like this is like when I teach in Zoom classrooms, we do a little like opening, like show us one thing that's within arm's reach that you always keep near you, or like one where you do high fives to each other like through all of the pain so that you have to like touch each other. I feel like this is our little like warm up activity.
I love that.
It is. Well, it is 1 o'clock.
Okay. Should
we give the Hood River 5-minute because everyone's always late? Yeah. Let's just be honest here.
Right. That's one of the many things I love about Hood River.
Oh, yeah.
The funny part is like it takes us 5 minutes to drive anywhere. So, you know, my other job isn't based in Boston and people are always late because of traffic.
Yeah.
And I'm like, oh, it's not for traffic for us. It's because I forgot to leave my house until the minute I was supposed to be somewhere.
Yeah. I do it all the time. I'm like, oh my gosh, I'm going to be late. And then I'm there in like 3 minutes. I love it.
Yeah, I think as a rule of thumb, I always make a habit of like Googling where I need to be at what time. And it tells me like the time you're supposed to leave.
Yeah.
And I'm like, okay, so I guess it can either take 30 minutes or an hour and a half. So I'm going to plan for an hour and a half. And then I always get there in 30 and I'm just sitting around for an hour. Like, this is what I get for trusting the internet blindly.
I get that driving through Portland. Like when I have to be in a meeting in Salem, I have to give myself an extra hour because you never know how long it's going to take you just to get through Portland.
Oh my gosh, such a nightmare.
Makes me so glad I don't live there. That was the original plan. When I moved to Oregon, I thought I was going to live in Portland, but we never made it that far west.
Good for you.
I know. People are apparently jealous that we got stuck in Hood River.
Mm-hmm.
I mean,
all the
great
time.
there, so.
I got stuck in Hood River too. I thought I was going to just be here a minute, and here I am 12 years later.
Exactly. What year did you move here, Kate?
I moved here 12 years ago. I was the director of events at Skamania Lodge.
Wow.
Yeah. And so I took a job there. You know, I was single and was like, okay, I'll be here just for a minute. And then met my husband and, 12 years and a kid later, I'm still here. And I love it.
To be.
I never meant to be.
Out. My sister moved to White Salmon in 14 years ago. So 2006. And we came out and we're like, that's where we're moving. But we thought like we'll be the city mice and you be the country mice. And but we stayed here for a minute to try to get jobs in Portland and got jobs here instead. And then we're like, why would we ever leave?
Yeah.
I'm gonna go to Portland.
Yeah. Some people are just meant to be here. Okay, let's see. We'll give 2 more minutes.
Anna, when you moved here, did you drive or did you fly?
We drove out from Montana. We were living in Billings at the time. So Jacob drove the moving truck with like our car towed on the back, and I drove the other car with our 3-month-old in the rear facing car seat screaming the entire time.
Oh, how long of a drive is that?
I think we did it in 2 days because it takes forever with the moving truck. So I think it took us like 15 hours, something like that.
Okay, that makes sense.
All right, you want to start? Well, I'll start. How about I start?
Sure.
Okay. Hi, everybody. If you are just jumping on or you've been on for a minute, I'm Kate Schroeder, the Executive Director at the Hood River County Chamber. I know lots of you, but some of you I do not know or have not met in person, so welcome. We are just trying to give you guys as much information as possible while we are all trying to figure out how to get through this crisis. Anna and I talked last week, and which seems like a month ago because a lot's happened between now and then. But so we just thought maybe, you know, she could come on and just talk about what she knows from a state level. And then, you know, just so you guys know, we also have a call tomorrow at 11 a.m., a second call with Rick Libovitz, who used to be at the SBDC here at the college talking about some financial planning. We did that yesterday, and there were so many people on the call that we needed to have a second one. So we're doing that tomorrow at 11. And then next Wednesday, we are going to have a call with the SBDC director, the Small Business Development Center, and Jessica Mehta from Mid-Columbia Economic Development District, who will be talking about the loans that are available and kind of talking to you guys about resources and stuff like that. So hopefully by next week, we'll have kind of more questions answered from the CARE Act that came out, the stuff that came out today. I sent a summary to all the membership. So if you guys did not get that, let me know and I will email it to you. But anyway, I will turn it over to Anna and let her just kind of bring us up to speed. And then when we'll do questions when she's finished. Okay, go ahead.
Awesome. Thanks, Kate. So I am State Representative Anna Williams. I have been living and breathing COVID-19 and the state response and our district's concerns and fears about the response for the past, 2 weeks, I guess, but seeming year and a half. What I'm going to give you all an update on right now is what the state is going to do in the short term and what we are discussing in the longer term. Just a little bit of a frame on that. Obviously, we all know this is like a global crisis. It's not just something that's happening in Oregon or happening in the Gorge. Oregon is the only small state in the country that's being as proactive as we are. We have new modeling out from OHA today that if the restrictions that we've currently put in place stay active, we will see a huge reduction in needing hospital beds necessary. Looking at, if we follow the rules we've been following, about 340 people needing inpatient beds by May 8th. If we don't follow it, we could see as many as 6,100 people needing inpatient ICU beds by May 8th. And so, again, reiterating, this is critical. I know that this is really, really hard for some of you as small business owners. And I want to hear more about that and how it's hard and what you're hoping to see from us. So that'll be something that Justin and David are here to take notes on. But I will start out by just kind of going over, at this point, we have 11 deaths in Oregon. That's updated number as of 11 a.m. Obviously, that's tragic, and our hearts go out to all the families and their loved ones who have lost people and the folks who are on the front lines doing this work. We have 7,269 tests performed in the state of Oregon with 316 positives. 90 people are in hospital right now. Still only one positive in Hood River County, one positive test. But we just received updates that testing should be ramping up significantly over the next few days to close to 1,000 tests a day. So we will see confirmed cases skyrocketing as we find folks who are already infected but just haven't been tested yet. I think we've all heard the state of Oregon has a critical shortage of ICU beds. So we are working on that. I will have some more detail about what that looks like as we go through what the legislature's response has been. We have called together a joint committee on coronavirus. They've met 4 times for about 22 hours over the past week and a half to hear testimony and consider policy proposals. They've taken over 1,500 pieces of written testimony. They've also got phone calls and plenty of pestering from folks like me about what we'd like to see. They have settled on some recommendations for top priorities, and that's what I'll be reviewing with you all today. That information will be publicly available on OLIS, the Oregon Legislative Information Site, very soon, but it is not out there yet. This is advanced information for you. What we are going to do is call a special session. It will be a one-day session. We are working right now to figure out if that will be Monday of next week, Tuesday of next week. It will be as soon as we can get everybody safely to the building who can safely be in the building. And we have to find out first if we even have enough people who think they can safely come to the building to hold that vote and what that will look like. So they're kind of currently thinking that we'll be sitting in our offices watching what's happening on the floor on our closed circuit television, and then go down 3 by 3 with social distancing measures in place to vote on the bill. And that we'll take argument individually. One person will be at their legislative desk talking while the rest of us are in our offices. And so it will be long and slow, but it will happen and it will be safe. And staff are not allowed to attend. We just don't want to put them at risk. So it'll just be us as legislators in the building. Right now, what they're doing is trying to deal with the things that are most critical. There are some pieces that we have heard from folks like you that are really critical that they are not addressing. I want to be honest with you about that. Some of the reason for not addressing some of those things you have identified as critical, and I'll go through again in more detail in a minute, is that some of that's addressed at the federal level with this new bill that was passed late last night or early this morning, depending on what time zone you live in. And we want to see how that shakes out. And some things that folks like getting rid of the week waiting period for unemployment insurance, I know was a big one for some people who are probably on this call. And we are not able to do that at this point because when we reached out to our federal delegation, we were told that would make us ineligible for the federal stimulus funding, and we can't weather this storm without that infusion of federal resources. So some of the things that we had identified as critical are not happening. And I will start going through the list right now. The priorities for the committee was really looking at small businesses and low wage workers and making sure that we can reopen business and keep workers housed and buying groceries during this challenging time. Feel free as we go. If you have questions, you can type them into the chat box and my staff can do some research and get back to you. Anything we can't answer now, we will email you answers to as soon as we have those. So getting to employers and small businesses, part of the policy that we will be working to pass in the next week includes a prohibition on commercial evictions for the entire duration of the emergency declaration and with a little bit of time after that point, so that you can get your business back open, start getting some revenue, start paying off some bills before the eviction process would be, there's a 30 to 60 day delay after the emergency declaration ends before evictions can start again, commercial evictions. We want to avoid situations where businesses are having to relocate supplies or materials because they can't use that facility anymore. Just seems like an additional expense. And so to the extent that that's something that might be happening in your life, you can keep us posted and we will do legislative advocacy for you as best we can. There's a prohibition on commercial foreclosures, also tied to that same timeline. Prohibiting judicial and power of sale foreclosures on commercial properties for a period extended I believe it's a month after the end of the emergency declaration from the governor. There's a big cash infusion that we're planning to send to Business Oregon for strategic flexible reserve funds and small business grants. This is in an attempt to address the unemployment insurance stuff that we couldn't do for you. like I said, there's a variety of reasons why we can't meet everyone's goal of suspending that week waiting period, but the intention is to use Business Oregon as a pass-through and support for small businesses. The focus there is on rental and utility assistance for small business owners. If you are renting your space, if you need help paying those utility bills, that would be grant money coming from Business Oregon. Rulemaking on that hasn't been finished yet, but that is what the policy will say. The intention is to try to offset some cash flow challenges for businesses, and they are trying to figure out who would be eligible. They're trying to focus on businesses that will be hardest hit. So please do reach out to us with your information about what hardest hit means in the gorge so that we can elevate that in their conversations to make sure that we're getting the attention that we need here in the district. We've heard a lot of conversation around implementation of the corporate activity tax, timelines, and rates. One of the issues that is really challenging to deal with along those lines are our school districts are also right now paying all of their employees who aren't working, and we're not sure what all of that is going to look like. If we were to suspend the corporate activities tax, as has been requested, we would have a $1.5 billion shortfall in the state budget, which we're not allowed to do constitutionally. So there's a bit of a dance going on there. They are doing some rulemaking. They're specifically looking at House Bill 4009, which I was a sponsor of last time, and gives ag businesses and food producers some additional flexibility. How can they use what was in 4009 and implement it in this new legislation to make sure that our food supply chain is continued throughout the course of the crisis? What other types of changes will be made, we don't know yet, but that is a conversation that is being had down to the nitty-gritty details. Again, if you have specific suggestions, you are welcome to send those to us. Department of Revenue has a lot of authority related to the CAT tax and how it's implemented, so we may not need legislation to address this. We may just do it through rulemaking and implementation. They may also do some relaxed enforcement for businesses who can specify hardship. So do be thinking about what you need there and continuing to communicate with us, so that I'm thinking about like a rural small business hardship model that we might be able to say you apply for a delay or a reduced rate if you need that to keep your business alive during this crisis. There's some regulatory relief around licensing requirements for a variety of different professions. We are extending recertification deadlines and continuing education unit requirements. Obviously, people are not able to be out getting CEUs right now to maintain your certifications. And all of that is extended to 30 days until after the emergency declaration ends, whenever that is, that people would have time to get their CEUs and re-communicate with their certifying agency to say, I've got my credits, I'm ready to re-up my license, but your license will not be suspended for lack of renewal or lack of continuing ed during the time of the crisis and for 30 days past that time. Let me just take a break. I feel like I've been barfing information at you for a long time. How's everyone doing? Getting it? Okay, all right. Expanded access to unemployment insurance. I know that's a big one for you. There's the hundreds of billions of dollars in federal funding. We are looking right now at that law. The speaker's staff and the governor's staff are reading it and trying to figure out exactly how it applies to what Oregon is doing. There will be some tweaks as we fit in what the feds are doing to what the state is doing, and try to hook those two things together as seamlessly as possible. What we're actually expecting on that is that we'll see how things play out at the federal level and call another special session to specifically deal with how do we allocate and use that money that might happen in a month with regard to unemployment insurance. But for now, the rules are what they were with the 1 week waiting period as they had previously been. We are also trying to be really creative at the state level for unemployment insurance for people who are not typically eligible. So people who are self-employed, people who are independent owners that you pay unemployment insurance, but you aren't eligible to receive it, and people who are independent contractors. What that is looking like is probably a separate like side system that won't be unemployment insurance, but will be grants to workers or coming through Business Oregon or other official non-governmental entities where we can give them a chunk of money that they then can disperse to people. The details of that are being worked out right now with our revenue chair on the House side, the chairs of the Ways and Means Committee and the COVID committee in terms of how exactly do they write that into legislation. We should see that by Monday, exactly what the details are. Employees and low-income Oregonians, the governor's eviction moratorium stands through the emergency declaration. Tenants who miss payments during the eviction moratorium are now required to be allowed to have payment plans so that they can stay housed after the emergency declaration is over. That will be mandatory for landlords to negotiate. Late fees on back rent will be prohibited. There's a requirement in that it is, we can document that that's all related to COVID-19 and not someone just deciding not to pay their rent during this crisis because they would rather have done something else with that money. Same restrictions apply to all commercial evictions. So commercial landlords will be required to enter into payment plans and not charge late fees. And there will be documentation needed to demonstrate that it is COVID-19 related. Emergency housing assistance will get a huge cash infusion for rental assistance for those who need it. That money will be going out, currently planned to go out through community action programs, which serve at every county in the state. We're working to also see if other nonprofit providers can be included in that cash infusion since the caps don't touch all of the folks who are at risk and need that help. There's going to be increased mortgage assistance in a program called the Hardest Hit program, which will be a grant from the state going out to folks who need mortgage assistance to stay housed. We're also significantly increasing our investments in food security through the SNAP, TANF, and WIC programs. That's one of those dual things where the federal money is going to come down and hit the state, and then the state's going to see what else we need to do to make sure that we're really meeting the needs at the state level. We're suspending in-person interviews for eligibility and all eligibility recertifications that need to happen during this time. You're just automatically going to be recertified until the end of the emergency declaration. And then again, we'll have a grace period after the emergency declaration is over for folks to get recertified and get their face-to-face interviews scheduled. Food Bank Network is getting a bunch of money. I think they said 150 million was the goal, looking at where we're gonna have to pull that money from in order to get that money out to the food banks. But we've seen about a 30% increase in food bank asks right now at the Food Bank Network across the state. And so we know that we need, and that's really sort of just the beginning. So we know that we need to make sure that they have the food that they can distribute, but also additional health and safety supplies and staffing as needed. The state has required different agencies to provide additional clarity regarding sick child leave. So the Oregon paid family leave program will be clarified via legislation that says families who need to take time off to care for sick family members are also needing to be eligible for sick time. How that comes out of their employer's pockets is something that I don't have the details on, but will be included in the policy that we pass next week. As soon as that's available, I'll send it to Kate, the draft policy. As soon as that's available, I'll send it to Kate that she can share with you all. And you're also welcome to email me and we can send it directly to you if you would like that. There was a bill that did not pass in the short session, which was around emergency siting for homeless shelters and had a lot of money tied to making sure that Oregonians living outdoors were able to get housing if they wanted it. Some of that bill is being pulled into this emergency package that we're passing for coronavirus, and there will be specific funding to provide hotel vouchers as well for people who are homeless and have coronavirus and need to get well in an isolated location so that we're not seeing additional community spread. Then there are some healthcare systems things. This is not my area of expertise, and I know a lot of folks are very concerned about what we're doing on the healthcare side. I'll give you a quick overview and then we can get into your questions, but I don't know much about the healthcare stuff. So we are banning out-of-network charges during the emergency declaration. So if you have to go to a different emergency room, you don't need to worry it's going to cost 5 times more than if you had gone to the hospital that's in your insurance network. We are allowing any willing provider provision so that all insurance carriers are basically in network during this time of crisis. We are adopting a uniform rate of reimbursement for hospital providers so that there's a lot less administrative back and forth as far as how many dollars does each payer owe to each different hospital system based on previous negotiated rates. That's just to get money out to the hospitals as quickly as possible, as cleanly as possible. We will be allowing physician assistants to practice without physician oversight, just to get as many medical providers into the field as possible. They do have to be in a detailed practice agreement and follow all related safety protocols and standards, but they can be giving more independent care than would otherwise have been allowed, just so we can get as many folks the healthcare that they need. We'll obviously continue to expand our telehealth capacity where that's possible and appropriate, and there's some funding in there to continue to support that, which was already something we were trying to work on, but now we're just amping up our attention to that. And new bed taxes for hospitals are being waived as they expand the size of their ICU units and add additional beds in. They're not going to pay additional taxes, which they normally would have had to do. They can increase size to meet the need without having to worry about increased bed taxes. We are also extending criminal and civil case timelines in the courts to keep court loads low so that folks can prevent community spread there. And that is basically that's all of the content that's included in the short-term bill. There were other things that folks had reached out about and wanted to address that will be addressed in the future. So, what are your questions? Amy M says, is there going to be something written that hospitals can't sue you for payment in the event you have no insurance but have to be admitted into the hospital? As of now, that is not something that we have a policy around. There was conversation around that at the federal level, and I haven't seen if that was included in any of the 3 COVID-19 bills that have come out yet. But Justin and David will take that note down, and we'll do some research and get back to people. What other questions do you all have? You can use your little raise hand button, or I don't know if you can unmute yourself and just say it into the room, but I'm happy to hear your voice if you'd like to ask it out loud. Kristen says, want to thank you for being here. Oh, thanks, Kristen. Doing my best. There is no prohibition on taxi or rideshare services, Matthew. As long as you feel like you can follow the social distancing protocols, and I'm sure you're being really safe and thoughtful about how you're keeping people from spreading virus in your service. We are absolutely encouraging you to stay open. I know you're also helping with grocery delivery. You're providing a service that is keeping people safe right now, and we want to support you in doing that.
Yeah, Anna, you know, it's a little tricky maintaining that 6-foot distance within a car.
Mm-hmm.
So I'm contemplating shutting down the taxi business and maybe just doing the pedicab, which I feel is safer. But I'm
perspective.
a little conflicted about, whether it's a service. I just got a call right now from someone at Mid-Columbia Center for Living who needs a client needs a ride up to Parkdale. Otherwise, they're going to walk. You know, there's no dial-a-ride cat at this point in the afternoon, at least. So I'm torn between providing a public service and also endangering, my community or my household. So
Yeah.
I don't know if you have any guidance.
So I know you have that minivan, and is that what you're using to do your
Yes.
taxi
Mhm.
services?
Yeah, and I have the pedicab, which I'm, the weather is starting to get a little nicer. I'm bringing that out, and I have a semi enclosure around it for mostly it's been for weather, but it also provides a barrier between my clients and myself
Mm-hmm.
as well. So I'm going to try to emphasize that more, but I continue to get calls for places. I just got a call to the Amtrak station for tomorrow morning that I can't do on my pedicab. So I'm
So
just wondering.
my recommendation is that you would reach out to McKed and Kathy and see how you and like what they can do, that you can just refer people directly to them, because they are doing all the cleaning and can do the 6 feet and everything else. I just met with Jessica Meta the other day to talk about that, exactly like what the public transportation system's looking like.
Right.
If you don't feel like you can do 6 feet of separation in your van, I don't think you should be. I mean, I just, as much as we want accessibility, it's not safe for you to be taking that risk for
There's
yourself.
this funny meme going around the internet with someone in Beijing, a taxi driver who's putting taped plastic all around the driver's seat, like a clear plastic vinyl.
Uh-huh.
I'm like contemplating whether to go to that, which would separate my riders from me.
Which is, and maybe, that's something to consider. You might want to, if you have the materials to do that, great. If you don't,
Yeah.
Maui Meyer is trying to coordinate people getting the types of supplies that they need from local suppliers and regional suppliers. So you could reach out to him and see if there's something physically that he could help you create a barrier. And then I would recommend wearing gloves in opening doors for your riders and closing the doors for your riders.
Yeah, we have automatic doors on the van, which is pretty great.
Yeah, so as much as you can limit that, the best you can. And Justin and David, you guys can do some research to see if there's any specific recommendations, Matthew, that we can send you. We have your email.
Right. Yeah, and I'm also pivoting to doing deliveries in errands, groceries. I'm doing a lot of prescription deliveries with a couple of third parties. So I also want to get the word out that's where I feel safer operating, in the delivery and errand running services. So,
which is critical in terms of support right now as well. So we can share stuff. If you want to send us any information, we're happy to continue to get that message out there. We had delivered last night.
Hardship who can't afford. I'm doing some sort of sliding scale as well and taking that into account, but I also have to account for my time too as a business. But I know there are groups forming who are doing volunteer deliveries and shopping for people. And I have kind of a Google Docs that Heidi Ventures been organizing. I just want to let you know, make you aware of that.
Okay.
There are groups forming who are doing volunteer deliveries. If I'm not available or people can't afford my services, so
okay,
make you aware of that.
Thank you. I have some of that, but not all of that. Heidi Venture, Justin, did you get that? Okay. So we will follow up with her for specifics.
Okay, great. And that's all I have to say. Thank you so much for convening this.
Of course. It's good to see you.
Good to see you.
Amy M says, have you heard anything about loan forgiveness for small business loans? I have heard some about the SBA program offering, let's see, they said if you're using the money to pay for payroll, that money would not need to be paid back. And that's federal support, not state support. We are working to align ourselves with that as much as possible and leverage that. So it may be that once we see exactly how that's going to play out, we try to give additional loan forgiveness for non-payroll related expenses. Not everyone obviously has payroll, but still has ongoing expenses. So that's something that we'll track in our office. And if we get additional supports beyond that payroll support, we will be making sure that that goes out to everybody. No proactive treatment to prevent ICU care. Miko says, I have a concern. There's no proactive treatment available to prevent ICU care. I know someone who has all COVID-19 symptoms and was told by Providence to stay home unless she literally can't breathe. That seems too late. It seems too late to me too. She's been told, although she probably has COVID-19, she can't get tested. I don't understand how we can track cases or shelter homeless people with symptoms if we can't get proactive testing or care. Yeah, I mean, you're not wrong. We are doing as best we can to get testing ramped up and get it here in Oregon. We reduced the regulatory oversight of independent test providers, and that's why we're looking at hopefully being able to ramp up to 1,000 tests a day in Oregon starting by the end of this week. We can't get a handle on it until we can get good testing, and I wish I had something reassuring to say about that, but I don't. We're doing the best that we can with the very limited resources we have access to and continuing to scrape and scrabble for additional resources. I wish I had something more hopeful to say. Amy M. is reminding people that Volunteers in Action at Providence is a good resource for things like Matthew was just talking about, prescription delivery, grocery pickup, those kind of things. Let's see, their phone number. I mean, you could just Google Volunteers in Action, but I used to run that program. So what is their phone number? They are not doing in-person services at this time, from what I heard yesterday. I don't know what their phone number is. Somebody else can put it in the chat box, Justin. Erica says, I have an employee who works for me in Hood River, applied for a temporary unemployment in Washington State because she lives over there. Should he have applied for unemployment in Oregon? The paperwork from Washington to respond. So in the gorge, my understanding is it's one thing. You can apply on Oregon side or Washington side because of the Gorge Scenic Area Act. There's no state line as far as businesses are concerned. If you live in Washington, you can apply for unemployment in Washington. So that should be just fine, Erica. He applied for temporary unemployment until April 6th. What happens if we have business closures longer? We are hoping that the federal resources will help support him, and the state will also be adding additional clarity in terms of extended unemployment access through the special session. And then again, we're probably gonna have another one in maybe 2 or 3 weeks to do a second round of not as urgent, but still emergency responses. And he hasn't had any response from the state in Oregon. Is this the delay you're referring to? So typically when you apply for unemployment insurance, there's a week waiting period before you're eligible to get your benefits. That's the delay that I'm referring to. My guess is that they're holding off on responding to folks who are applying during this time because we're trying to figure out what benefits are going to look like. They just want the answer from the state before they tell workers, here's what we're going to do for you. What direction they have been given is that we're keeping the 1 week waiting period, and they'll still get their benefits as to starting the day they applied, but they need to do a little bit of math on how to calculate those benefits. They don't have the instruction yet as far as what rate to provide benefits at. So the week waiting period is how long it takes to get your check, not what you get paid for. Laura Clement, any opportunities for self-employed to access unemployment or something other than loans with no employees? That is the hope, Laura, with this unemployment insurance, expanded access to unemployment not covered by the governor's expansion. That's money that would be going to Business Oregon to go out, hopefully in the form of grants and not low interest loans. We will be seeing more details about that by Monday from the state legislature. Volunteers in Action's phone number is 541-387-6404. They're fabulous. What resources are available for people who are homeless? We are working in Hood River to put together an emergency shelter plan. Sarah Kellums is coordinating that with Gorge Ecumenical Ministries, and I know she's been updating folks via Facebook and the We Be Preppin' Facebook group and a couple of other local natural networks that have arisen. There is additionally through Gorge Ecumenical Ministries, but some of their other programs. Their Somos Uno program is providing support directly to folks who may be ineligible for other support due to immigration status. And they also have emergency food and electricity. I've heard that they are running out of money much more quickly than they were hoping to. So anyone who finds an extra $100 bill in your pocket, your old winter coat, go ahead and donate it to Gorge Ecumenical Ministries if you can. In the longer term, the state is trying to infuse additional resources to food banks, community shelters, and through like school systems and other sources for support for people who are homeless. As far as showers are concerned, we were trying to revive some of the emergency agreements we had made with bathroom, hand washing, and shower station providers from the eclipse. There were a bunch of contracts that were put together between the state and emergency service or like hand washing station providers. They are trying to reactivate those contracts and get stations out to communities. If you are aware of a good shower site, let us know, and we will work with the state to try to get something sited that people can get clean. Last time we had a crisis, remember maybe 2 years ago when there was that horrible snowstorm and the shelter itself, the homeless shelter closed. Providence took in a bunch of people. We had like an emergency homeless shelter in the building in Providence, and the Hood River Athletic Club allowed people to shower up there, as did the pool. Those things might be reactivated if they get community pressure. It'll be harder to do to prevent spread. We need to make sure that everyone has proper distancing protocols in place, but those are responses the community has done in the past and could do again. I would recommend reaching out maybe to Mark Thomas at the hospital. He's the director of spiritual care, and it's kind of his job to make sure that the Providence's response to homeless people in our community is responsive and respectful. So if that's something you have details about, he's the guy to go to on that. Do I foresee a more aggressive stay-at-home order coming for the state that will force more businesses to close? There are timelines in place, Erin, to assess that decision. We just got today, it's called Working Paper, Projected COVID-19 Epidemic Trends and Health System Needs for Oregon, from the Disease Modeling Institute in Bellevue, Washington. That is looking at 3 different scenarios of social distancing measures. There's the do nothing option, which we had sort of done before. There's where we are now, and then there's a third, more aggressive option. We are planning to stay with what we have right now, unless as we work our way through that modeling, it shows that we are just not going to be able to make our hospitals, keep our hospitals at capacity or under capacity. That would be the only reason why we would see more aggressive orders coming out. The governor is trying to really, and I've been on calls with her, there's like the density response for folks who are living on the I-5 corridor and what they really need to be doing. And then there's like all the rest of us. We have different abilities to be separate and to sort of live our lives without sharing virus as drastically. And we also have different needs in terms of our businesses and what our supply chains look like and what our employees look like, and hospital capacities, right? Like almost no one in Eastern Oregon has enough ICU beds if this gets bad. So what the governor's trying to do is respect us and let us live our lives and trust us to follow the rules. If we show her that we can't do that, we will see more draconian measures, but she does not want to do that. Senate bill cited an additional $600 for unemployment. Yeah, so the $600 per person for unemployment is for, the intention is that would go out to anyone in any state who registers for unemployment through their state, and it would just be an additional $600 check that goes out to those folks. There's been some back and forth on why that dollar amount, and how does it get to people? As of right now, the plan is when your unemployment application is approved at the state level, the state notifies the feds and the feds issue that $600 check that comes to you. It doesn't have anything to do with how much you were making prior to or how much you might make in the future. It's just $600 in cash. The intention is keep your bills paid, get your groceries paid for, so that we can weather the storm a little bit more easily. From what I have heard, that did pass, and there's no like they're going to take it back from you or make you pay it back later. Is that the question? Do you have other specific questions around that $600? I think you're frozen now. Galaxy Note 9. Oh, you were unmuted for a second. Did I answer your question on that, or are you all good?
I think that was Lorraine.
It is Lorraine. Sorry, I didn't realize I could change my username before I started on my phone. I've never done this mobily. So is that $600 a one-time check? Because I know our employees are going to ask.
Yes, that is right now a one-time check. This everything with the caveat of like, here's what we're doing today, and we'll probably have to do more tomorrow. But for now, it's a one-time check.
Okay, thank you.
Sure. Any other questions, folks?
I have a question, Anna. We have quite a few members who are asking, they're nervous about this, if we decide to take the next level and put more restrictions. And there, we have quite a few like essential businesses. And I know in some other states, I think California, they designated some essential businesses like Ace Hardware and like Short Supply and Outdoor Play. They have medical supplies, water filters. Is that something that you think can happen at a state level? Because we would hate for everything to shut down. And a lot of those stores are kind of, they're .com companies. And so they are actually doing that for the entire country, not just for our area, but then they are also a local provider. And so I think there's some concern that they can't provide the things that they need to provide at a national level and at a local level.
So we had some folks reach out last week who do septic supplies. And obviously that's an essential business, especially for rural folks. And we had reached out to the governor's office to ask that exact question, like, are you going to be identifying a list of essential businesses? They said that they are not. We heard back from two of the economic development director and the chief of staff. They said at this point they want communities to identify what essential businesses are essential. And to do as little regulation of that as possible. If industries need or specific businesses need a specific, you are a non-essential business to be declared for some sort of eligibility for support, that is something that you could reach out to us individually to see if we can get you declared a non-essential business. But as far as declaring businesses essential, they want to do as little hammering as they can with that. They don't want to have people have hall passes so that law enforcement has to pull you over and find out if you're allowed to be driving. They really want us to handle that ourselves in terms of they're not trying to close anybody down who feels like they have something they can offer to the state or the country. Does that answer your question, Kate?
Yeah, so basically, if you don't close, no one's going to make you close, right?
Yep. Exactly. Unless somebody files it, people can file a complaint. If they go to your business and they see you not doing the social distancing stuff, that would be the only other way you could get in trouble. And that would be a misdemeanor as far as what we know right now. It wouldn't be that they would force you to close, but they could charge you with a misdemeanor for not following the social distancing guidelines.
Okay. I think that's just good to know if the next step happens, because I think that's going to be like the next questions that start to come, Yeah.
And what does that next step look like?
Right.
Yeah.
Okay. Thank you.
Yeah, sure. Erica says, how long are current restrictions for the emergency declaration going to run for at this time? The governor's emergency declaration. Oh, I'm sorry. My staff just typed into our little shared document that there are some media sources reporting, Lorraine, that it might be $600 a week payment until the end of the emergency declaration. So we will get that detail and follow up with very specific actual facts. Sorry. And Lorraine, did you want to make a comment to Matt right now? And I want to make sure I'm answering the emergency declaration duration answer.
I did. Matt has been such a huge part of kind of keeping things going. But my one thought about him separating himself in his minivan is that if someone who is in fact positive to COVID rides back there, and then the next person gets in, then that issue exists of they're touching the seat or, the handle or whatever. So I don't know if he really wants to get in the business of disinfecting after every rider.
That's what I'm doing right now. I have
Are
a
you?
whole disinfection regime, spraying down and wiping down all touch surfaces.
If you're good with that, I just worry about you.
Yeah. I'm constantly revising the procedures and talking with my coworkers,
Cool. All right.
collaborators with it. But I appreciate your concern and
All right. Just take care out there.
Sorry, I'm navigating more than one screen and my mouse is having a mind of its own right now. So there are a few different disaster declarations or emergency declarations. There's like the school closure declaration, there's the parks closure declaration, there's the social distancing business guideline declaration, and they actually all have different ending timelines. Isn't that fun? The reason for that was they wanted to make them as short as they could with the option to extend them if need be. And at each day when they made the declaration, they made it with the timeline that the Department of the Oregon Health Authority, the public health officials in our state thought would be necessary. And so as of right now, the policies that say they will last until the end of the emergency declaration they're related to the governor's overall, like Oregon is in a state of emergency because of the COVID-19 pandemic. And that I believe ends May 1st. Justin, do you know?
I don't know off the top of my head. I'm looking it up right now.
And so everything that says that it goes to that plus 30 or plus 90 days will continue to be extended if the emergency declaration is extended. But for now, we're thinking most of those things will start, the grace period will start on May 1st and go for 30 or 90 days, depending on whether it's the mortgage insurance or the unemployment insurance timelines that they've created. There are details on that being ironed out with like the legislative staff right now are looking at what's legal in terms of those grace periods. If there are statutory reasons why they need to be shorter or longer, we'll know that Monday or Tuesday when the actual draft bill comes out that we're going to get together and vote on. And we are happy to send that to you. What can you answer why our public health department won't release what area in the county is affected by the positive? I haven't spoken to them about why they haven't done that. What they have told us via email, which is the same thing I'm sure, Amy, you've probably heard publicly, is that there were a few folks who were attacked. Their home was attacked when folks found out that they had the coronavirus in Washington State. And our county is being very protective of the folks who have positive test results because we have such a small community. I think they're afraid if we say it's somebody in Parkdale, it's pretty easy to figure out who that might be, and that person might be at risk. So I think their thought process is really just protection and privacy of the patient. And it's worst case scenario thinking right now, unfortunately. right? Like we don't want somebody to go do something bad to this family while they're already stressed out and overwhelmed. And I wish that we weren't always in liability limitation mode, but I think it's hard not to be when you're in a panic. I hate being such a Debbie Downer. I'm sorry. Any other questions or just thoughts, things you would like, God, I wish the state was listening to this thing that's happening in my life right now.
I think we missed, did you see the one for when the restaurant and bar emergency declaration will end from Kristen?
Oh,
Send it to her. Did I miss it, Justin?
no, I think we missed it.
Oh. State of emergency for 60 days on March 8th, but will reassess whether it needs to be extended toward the end. Was that the answer to the restaurant?
It kind of goes with Rep. Williams was talking about how the governor declared a state of emergency, and within that state of emergency has issued several orders issuing kind of guidelines for different businesses and those sorts of things. And I think the intent was for those guidelines to be in force while the declaration of emergency is still in place. So I do think that answers the question that the declaration will end May 8th or thereabouts, 60 days from March 8th, and potentially reassessing if it needs to be extended in that time.
Okay, thank you.
Yeah, I know.
Oh, no.
There's also this Oregon COVID-19 response page. On this page, I'll paste the link into the chat. This is where there's updated information on cases and counties, but also if you have services or supplies to donate, if you are a business that would like to sell to the state any of the equipment or supplies that you have, there's a form to fill out there. And there are some other resources and links as far as updated information and different responses for different industries and guidelines. So feel free to check that out. And again, if there's something missing from there, if you reach out to us, we'll get it right in front of the governor as quickly as we can.
Yeah, and just so everybody knows that I am the county's business liaison between, the county. And so if you have a business question about being essential business or, how that works, you can contact me and I will get you in touch with the right person. But I'm the business liaison. So any questions about that, send it my way. But there is, like Anna was saying, there's a form. We have a couple local companies that have made hand sanitizer, large quantities of hand sanitizer that they wanted to keep into the community, but then the county didn't need it. And so now they're going to try to sell it to the state. So anything you think that you might be able to have that can help the state, there is a form and they could very well purchase that from you. But don't put the cart before the horse. I think we've had some people that kind of did some stuff before they figured out the process because there wasn't a process. So now there's a process. So let me know if you have questions on that.
Awesome. Thank you, Kate. And that reminds me, there have been some confusion around receiving supplies and distribution of supplies. There's basically 3 entities that are getting supplies into the state of Oregon. There is our emergency management team that's working for the state. There's our public health emergency healthcare supplies system. And then there is the like the fire marshals, and they are working with the, what is the word? It's not the active duty military. It's the folks who are called to service. Why can't I think of it? National Reserve, something like that. What's it called?
National Guard.
National Guard, yes. They are working with the National Guard. Thank you. To receive and distribute supplies to the different entities. So depending on where you live and who your emergency response, like Barb Ayers in Hood River, they should be telling her all the data, all the supplies that are coming and going and where all they're being dropped off. But some folks are hearing only from National Guard or only from the Oregon Health Authority. And there's more than that that's happening. It's confusing. There are reasons for that. different entities have access to different parts of the state budget, and we can better leverage our money if we're using those 3 different tracks to get the supplies we need. But if you hear confusion going on, that's why. Kate, I saw you just unmuted.
Yeah, and the reason why they made me that person was because Barb Ayers was being bombarded by business. And so she's asked me to kind of alleviate that, so she can concentrate on the stuff that she needs to work on. And then I'll work with someone on her team to figure out where stuff needs to go. So please do not contact Barb Ayers.
No.
If you have a question, contact me and I can get in touch with Barb Ayers for you, okay?
Okay. Thank you. Amy M asked, what is the probability that schools will reopen this term? I don't have a crystal ball, but my personal assessment is very unlikely. My husband teaches at the high school. They have been called back in starting Wednesday to do distance learning planning and support. All of that stuff will be optional because Oregon does not have the capacity to provide the same level of education to every student across the state, since we don't even have internet for some students in parts of the state. But they will be working, they will be providing lesson plans, and those will start being available toward the end of next week, from what I understand. How are businesses handling mail and shipments? We're told by UPS if we don't receive shipments or mail for 7 days, we'll be cut off. Yeah, that doesn't make any sense. Kate, have you heard that? How do you get?
I haven't. I want to ask Aaron from Outdoor Play because they do tons of shipping. I don't know. Aaron, I'm going to unmute you. Are you listening?
Yes, I am.
What do you know about UPS and shipping and all that?
I met with the UPS department heads last week, and they're going to remain functional until ordered to do otherwise by the federal government. They've been deemed essential by the president in the last discussion regarding it, and so there's no plans to shut it down in the near future. Does that answer your question?
Was that from Erica? Hey, Erica, does that answer your question?
Am I unmuted? Okay.
Muted you.
Not exactly. Peppy, maybe you can.
Well, it doesn't quite. So we were notified by UPS driver that if you are not receiving packages 7 business days in a row, they will discontinue deliveries to your address. So we're just curious about how other businesses are handling shipments that are coming in, like also interactions with drivers. Are people having the driver drop off in front of their business the package? Are they having the drivers call them? I don't know how many people are getting frequent deliveries, but with our storefront closed, it's a bit of a challenge trying to time how it can meet the drivers for our shipments. So I was curious how other businesses are dealing with this.
So we get shipments every day, and we've completely separated it in our warehouse. So the driver, we've made this system as part of our preparedness plan to keep our staff separate. Everything that comes in the door gets a complete wipe down once the driver leaves. So the drivers come in through the man door, my staff exits the area, they unload into the warehouse. My staff then goes, wipes it all down, and then distributes it. So that's kind of our plan. As far as I haven't heard about the 7-day rule, that's a new one for me, but it wouldn't necessarily be relevant for us given the frequency that we receive shipments. I can ask we have open line of communication with our UPS and FedEx representatives. I can definitely inquire if that helps.
Yeah, and I'm not sure if it might be a driver-to-driver basis as well, too. We've also been considering talking to Brad up at the UPS store just to make sure if we have an alternative mailing address there or billing address so we can have them to receive packages, but we don't really necessarily want to have them take an unfair load so we're just kind of curious what other businesses are doing. Yours is definitely a different situation. That you've got a warehouse, you're doing warehouse deliveries. We are receiving deliveries at our storefront, so opening the front door when a driver comes up, I'm dealing with that. So it's more of it's not necessarily a relevant thing, I think, in your case, but I was kind of curious if there are any, restaurants might be dealing with this, the food supplies or other small stores, or maybe everybody's just kind of, I know talking to other retailers around the country, a lot of them have canceled all of their pre-booked shipments. And so a lot of retailers are not receiving any packages or any shipments. Again, it's a different situation. You guys don't have a storefront, so you guys are always online anyways. But I'm not sure if you guys have also cut down some of your inventory as well. But
That's not relevant.
Yeah, but it's not relevant. So what we're trying to deal with is how to manage our shipments and how to manage if either us or an employee interacts with the driver because we don't have a warehouse to have them drop off. It's good to hear that you're doing the quarantine kind of thing. What we've been doing is we receive a package, we drop it off in one section of the shop, have the employee go clean their hands, and then we just say, let's not touch it, leave it alone for 24 hours, and then we'll come do it the next day. So.
But the other question too is just daily mail. When the store's not open, do we do a holding order on our mail for, or has anybody been dealing with that? Who's in a closed, we have to have a closed storefront, so we don't know what to do.
Yeah. Anyone else in the room? Have you?
We
similar
have.
situation?
So we've just been watching our UPS tracking, and we've just been coming down to the store and waiting and just letting the driver come in and drop it and just not dealing with it because we don't really need to deal with anything immediately. I suppose if we did, we would sanitize. And then as far as the mail goes, if he can slide it through the small crack in our door, he does, but he pretty much rolls around the same time every day, and he's been coming back too. And we've left a note for him before and said, we'll be down between 3 and 4 if you're out, and he comes back. So we've just been kind of dealing with it on a personal basis, kind of.
So, and I don't know anything really about the UPS side, but at the U.S. Postal Service side, I know that they are doing everything they can to be responsive and supportive. So you might just want to call the post office and explain what you've got going on and see if there's something that they could do to work with you. I was just talking to, oh my God, Emilio's mom, Rocio, who, and she just said, just tell people to reach out to us. We're trying to do everything we can. We've got to keep our workers employed, and people are coming in from all over. Most of her employees or folks who work there come over from Washington. So there's a little bit of an issue as far as making sure there's still staffing there, but they're happy, I know, to work with you. So you might just want to reach out to her.
Excellent. Thank you.
Yeah. What else, guys?
I have a quick question if there's, if you're not addressing one in the chats, and if you've already addressed this, I apologize, but say you do have, we've whittled our operation down to minimal, and it's just a warehouse staff, and it's closed to the public, and so it's all, we feel like we have a really solid plan to remain open during this time. But if one of our employees does test positive, then what is the chain of events that we can expect after that? And how long do we need to close for if that is the case?
That's a really good question. We don't have specific guidance about we absolutely should have if there's an employee who tests positive, here's what we recommend the business do. I will put that in front of the Oregon Health Authority and get back to you. As of right now, I would let everybody know somebody's tested positive. Don't come in for a couple days while we figure this out, and then let us know immediately and we'll help you figure it out. But we'll get better guidance from you that other folks can use to plan a response. So it's not just a catch as catch can kind of thing.
Okay.
That's great. Thank you for that forward-thinking question. Justin, can you email that once you get it to Linda and Alana? Thanks.
I just wanted to respond to Pepe. It's second win that we at Short Supply are just doing deliveries on 2 days a week. We just set up with the driver that will come in Tuesday and Thursdays from 10 to noon and pick up or let them basically drop the delivery, and then we're kind of letting them sit for a while as well at this point.
Thank you very much for that. That's a great idea. Maybe we'll sync up with you guys.
Yeah, thank you.
We're all in this together, right?
Together, but separate.
Yes. As together as we can be.
Anything else you wish that we had addressed, or Erin, you have please tell me, state, what I should do here so we can get some clear guidance for you.
There's Aaron.
Yeah, there's, looks like Kristen's husband has some up-to-date Hood River Health Department info. And we had heard from Tofurky that they're putting together a plan, so hopefully they have something clear, but I think the state should issue specific guidance as well. Excellent. Thanks, Kristen. You're so helpful.
Thank
Yeah,
you.
if anybody has a great plan, you know, share it with me. You know, because then I can share it with the rest of the business owners, because I think everybody's kind of going down that what happens next path, you know, now worst case scenario path. So that would be great if you guys could share that kind of stuff with me. That'd be great.
Amy says, it'd be great if we don't run into the same problem we did with the water shutdown. Is everyone and every message on the same page for this? I don't entirely understand what the question is, Amy. The water shut off being that there was unclear information about when people could start using their water again, or?
Amy, I unmuted you. Oh, she's typing.
One message from the city and one message from the county about that. I mean, I can't, I wish that everyone was on the same page and had the same messaging. We at the state level are trying to put together a clearer process so that you don't hear one message from the legislature and one message from the governor and a third message from Oregon Health Authority. I know that was happening last week and it was frustrating for everyone. And so they are putting an incident command team in place that will be the sole messenger for COVID-19 related policy changes and updates at the state level. I would recommend that the city and county do a similar process where they have one point person, or one, not person, because that person will get burned out, but one sort of point entity where we can use, get good, clear information from. At this point, that has not been put into place. It doesn't exist yet. Everyone encouraged to use, yes, please, people, use your touchless payment methods as much as possible, Venmo, Cash App, Apple Pay, to the extent that businesses can set up those accounts. I think that's safer for everybody, especially your employees. And if there's any regulatory burden that is preventing businesses from accepting those touchless payments, do let us know. And here's the issue, here's the app, this is why we need it. We will get that to the governor's economic development director and do the best we can to get a rule change, at least temporary, so that you can use those safer payment systems. And you just email those kinds of things to rep.annawilliams@oregonlegislature.gov. We've been getting really quick turnaround from the governor's team. So feel free to just I'm telling this, Justin, hide your face. Just barf information at us and Justin will get it where it needs to go. He doesn't have anything else to do.
Everything's very laid back right now. There's not much going on, so.
But this is really what we're here for. So it'll take priority over other stuff. As much as you need to reach out, we'll get everything we can to you. Tofurky, Kristen says, Tofurky's coming up with a comprehensive plan involving the county health department and OSHA. Everyone definitely needs their own plan. But Dave says, reach out to him at that email above and he can point you to the folks who can guide you through that. Awesome. Anything else, folks? Frustrations or fears, not necessarily policy fixes that you need, but just, dang, this sucks.
Yeah.
Yeah. You're so welcome. Thank you. Stay healthy. I am here in my bedroom in Hood River, so if you need something, let us know. We will do everything we can. I wish we could do more. I know that there are some unsatisfying lack of clarity right now, and I am sorry for that. We're doing our best, and we're going to keep doing our best until it's over. And I'm really impressed with Hood River. You guys have come hard to get each other's backs and look at how we could be creative and work together. And I'm once again proud to live in this community. And it's because of the people like you, Maddie, who are out there making sure folks have their groceries, and Aaron, they get through everything proactively. And I mean, you guys, you're awesome. Thanks.
Okay, thanks you guys. If you need anything, let me know, or you can reach out to Anna on your own, or I can do it for you, or just whatever you need. We're just all trying to help you guys, so let us know.
Yeah, and Kate and I, we can do this again. You know, as things change and update, we'll be available. So
yeah, maybe after you vote and we get everything laid out, you know, we can do it again and walk through everything and see if anybody has questions.
Absolutely, that's a great idea.
Okay.
Okay.
All right. Everybody have a good day.
Thank you.
Thank you.
Take care.
See you guys.
Thanks, everyone.
Yeah.
Kate, is there anything that you want to check in on with me before we ring off?
I don't think so.
Okay.
I think you gave a good overview, all the questions. I might though. I'll think about it.
No, there's no timeline. Reach out later if something pops up.
Yeah, I do though. I do think it would be helpful if maybe after everything gets, you know, because it's like there's so much information coming at people right now. I mean, even the summaries are 7 pages long. So it's like, you know, I'm trying to next week maybe get somebody from Greg Walden's office, and then to kind of walk people through like what the federal plan is and ask questions. And then we'll have you guys come back and do the state side, just because, you know, I love you government folks, but you know what? Half the stuff that comes out, we have no idea what it means. So I'm just trying to help people sift through what's important and what's not important.
You also, just as a recommendation, Merkley's office has been really helpful to us.
Okay.
I unmuted to say that exact thing.
Yeah.
So in terms of like giving us usable chunks of information as far as what's happening at the federal level, Molly
McGuire, yeah.
Has been really, really helpful on Merkley's staff in terms of translating government-ese into normal person speak.
Hey, Justin, can you send me your email address?
Sure, I'll also send you Dan Baum's information. He's kind of
and I'll just reach out to them. I haven't heard from Garrett, but I was just like, who can help me? So I think that would be great to have somebody just kind of be able to answer questions on the federal side.
That would be great. I would come to that just to hear it.
Yeah, I think it would be awesome. Okay, well, Linda, are you doing okay? I saw you get on there. Are you good?
I'm okay.
Hanging in there?
Yeah. I do have a lot of questions, but I think it'll become clearer as we get into this further.
Right. So I think you just stay in touch with what we've got going on here, and let me know what your questions are. And as I can get some experts on here to try to explain what's going on, that's my whole goal. So next week should kind of be like a packed schedule.
Thank you so much for having this meeting. And
you're welcome. And we're going to all figure out this Zoom thing. I'm having fun. I'm like, we're going to do this all the time, even when
right? We don't have to go back to working in an office. We have Zoom now.
I love it. Or meetings, you know, it's just so much easier just to do it like this. Okay, well, you guys have a great day, and let me know. Hey, Maddie, I hadn't said hi to you. Hey, Maddie, thank you.
Hi.
Hi.
Maddie, you're awesome. Thanks for all you're doing.
Yeah.
Thank
you, guys. Have a good day.
All right.
Gives me a sense of purpose.
Good.
This
is really important in these times.
Yes, it is.
All right, everyone take care and stay healthy.
Thanks,
guys. All right, well, I'm going to ring off, Kate.
Okay.
Reach out anytime.
Yeah, thank you. Bye. Thanks, Justin. Okay, bye-bye.
Hi, guys. Thanks, Kate.
Thank you.